Welcome to the Susan G. Komen Central and South Jersey's first webinar featuring Dr. Christopher Ananian from Princeton Radiology. My name is Gina Vinch. I'm the Development Manager at Komen CSNJ. Today we will be talking about breast imaging in the time of coronavirus. For many women, breast cancer screening is already coupled with anxiety, and now there's an additional layer of anxiety brought on by the coronavirus pandemic. Women are worried about being forced to delay their screening exams to comply with the stay-at-home orders to help flatten the curve. Understandably, many of our followers have questions and concerns. One of the missions of Susan G. Komen Breast Cancer Foundation is to educate and connect women with experts to help answer their questions. Today, I am joined by Dr. Christopher Ananian, a diagnostic radiologist and breast imaging specialist with Princeton Radiology. He is a member of several medical societies and professional organizations, including the Radiology Society of North America, American College of Radiology, and the American Medical Association. He also serves as a co-chair on the executive committee for breast imaging for the Radiological Society of New Jersey. Dr. Ananian, thank you for being here today.
It's my pleasure. Thank you for having me.
Well, we understand this definitely isn't a time for business as usual, but maybe you could help answer some questions that we're getting from our constituents. Can you talk us through how Princeton Radiology is responding to the coronavirus during this time?
Oh, absolutely. These are by far and away unprecedented times. And Princeton Radiology is an essential business. So we are still open and taking care of many of our patients. At this time, when especially the hospitals are being overrun by COVID cases, the outpatient imaging centers are here for urgent medical needs as well. So our mission at Princeton Radiology has always been to provide high quality imaging in a clean and convenient environment. We strictly adhere to the guidelines that the CDC, the New Jersey Department of Health, and OSHA have established in order to minimize the risks during this pandemic. So what we try and do is we try and take care of the health and safety of our patients, our employees, and the surrounding community, and we're doing everything we can to try and minimize the health risks to our patients. We've instituted enhanced cleaning procedures in all of our facilities, where all of our equipment is cleaned both before and after every exam. Our patients are being screened so that for any symptoms of coronavirus, so that if they do suspect that there is an infection, they will not be imaged in our offices. Those are cases that will be transferred over to the hospital for imaging. And we are also we're taking patients quickly into our exams, trying to keep our waiting rooms as empty as possible, in order to minimize the contact with other patients. And then we're also anticipating rescheduling or scheduling our screening mammograms starting after May 3rd.
The last point is one that our followers have been asking about. Can you clarify for us the current recommendation with regards to breast imaging?
Of course. So screening mammograms, according to the American College of Radiology and the Society of Breast Imaging, in compliance with the CDC guidelines, they're recommending that patients delay all non-emergent screening outpatient imaging studies until the worst of this crisis has passed. So these include things like screening mammograms, lung cancer screening tests, things like that, which can wait a couple of months until the peak of this pandemic has passed. So right now, we're recommending that patients who are anticipating having screening mammograms wait 2 or 3 months until the worst of this is out has passed, which is why we're scheduling our patients starting around May 3rd in the anticipation that we'll be able to restart our screening studies.
Can we go through a few scenarios to make sure everyone understands?
Absolutely.
So if I'm due for my annual screening mammogram now, what should I do?
You should plan to schedule that for May 3rd. So if you have a screening study, we're trying to delay those until after the peak of this pandemic. So after May 3rd, we can start resuming our screening studies. However, if you if you do have any signs or symptoms of breast cancer, that changes the scenario a little bit.
Okay, what if I'm experiencing any change in my breast? I feel a lump or a mass.
Right. So there's a difference between screening studies and diagnostic studies. Screening studies, we're recommending that everybody waits for a little bit, and that's where we're scheduling these until after May 3rd. Diagnostic studies, however, create more of an emergent study, which is why we're recommending that those patients schedule them on the more immediate scenario. So if you do notice any lumps, any bumps, any changes in skin texture, any puckering of the breast, any tenderness that's unusual for you, those are cases where we're saying, you know what, why don't we we'll do the evaluation, which will require a diagnostic mammogram and sometimes a diagnostic ultrasound or MRI in order to fully evaluate what exactly is happening.
What if I was told I need a breast ultrasound, MRI, or biopsy?
So right now, if we're doing a workup for a new change, a diagnostic evaluation for a change that you've experienced, those are things that we are doing right now because those are considered more emergent studies. If you are working up a change in the breast and you've been scheduled for an ultrasound or a mammogram, those are still being scheduled and the appointments are still being made. For a biopsy, the same thing goes. If your doctor, if the radiologist has seen a mass that's suspicious or highly suspicious, and they want to evaluate this more with a biopsy, those are also still being performed at our offices in order to fully evaluate the change in the breast.
And what if I'm at high risk? For example, I know that I have an inherited genetic mutation that increases my risk for developing breast cancer. Should I have a mammogram now or wait?
Again, even though you are a high-risk patient, the screening evaluations can wait for 1 or 2 months, which is why we're scheduling our patients starting around May 3rd. So even though you are high risk, which creates its own level of anxiety, these are still studies that we can postpone for 1 or 2 months in the anticipation of waiting for this peak to stop.
And finally, what if I'm a cancer survivor that is due for my follow-up screening? What is the recommendation for me?
Being a cancer survivor creates its own level of anxiety, and although it's one of those cases where it's once bitten, twice shy, you sort of don't want to postpone anything longer than you need to. However, we're still recommending that those patients still be screened after May 3rd. So wait for the peak of the pandemic to start to flatten out a little bit, and then we'll be able to resume those normal screening studies, understanding that waiting 1 or 2 months is not going to create a large amount of concern. That being said, that there isn't any change that you've noticed in your breasts.
Dr. Ananian, thank you so much for being here today and sharing this information to hopefully help diffuse some of the anxiety surrounding breast imaging in the time of coronavirus. Do you have any final thoughts to share?
So I understand that there's a lot of anxiety surrounding the screening breast mammograms, and that's being just compounded by the current pandemic situation. However, delaying your screening study 2 or 3 months in order to protect yourself from a more potentially deadly virus right now is the best option at this time. That being said, I always encourage all of my patients to be their best advocate for their breast health. So if that involves mostly doing screening breast self-exams, know what your breast feels like. That being said, if there is any change, that should be reported to your doctor so that we can do a diagnostic evaluation if indicated. Princeton Radiology is still performing diagnostic studies. And although the recommendation for most breast imaging services to be delayed at this time, that may not be the best option for every patient if there is a change or something that's causing concern in your own breast health. So for some patients, waiting may put them at a higher risk. So that's one of those areas where I would say if there is anything, you need to discuss those risks as well as possible COVID exposure risks. Weigh that versus the benefit of getting the imaging done at this time, and discuss that with your primary care provider.
Thank you again, Dr. Ananian. We really appreciate you being here with us today and helping answer some of the questions that we've been getting from our constituents.
My pleasure.
The Komen website has a page dedicated to COVID-19 and provides many resources. Visit our website at www.comencsnj.org/coronavirus. There you'll find information that includes the Komen's Breast Care Helpline, which is available Monday through Friday from 9 a.m. to 10 p.m., providing social support, coping strategies related to anxiety or concerns during these uncertain times. Calls to the helpline are answered by trained and caring staff members and are available in both English or Spanish. Call 1-877-GO-KOMEN or email at helpline@komen.org. We also have the Komen Treatment Assistance Program, which provides financial assistance to local patients dealing with crippling costs associated with breast cancer treatment. To learn more information on this program, visit KomenCSNJ.org, hover over the Community Impact dropdown, then click the Treatment Assistance Fund. Thank you again for joining us today, and we look forward to providing you with more webinars in the near future.